are thrilled to welcome you all to another exciting and inspirational episode of Concorde Conversations. This is an initiative by Concorde Medical Group to educate, empower, and encourage our community to improve their health so we can all live to our fullest potential. Today's discussion, tricks and treatment, a discussion about allergies, the common cold, and COVID-19. Hi, I'm Dr. Catherine Weinberg, Director of the Adult Congenital Program, and I'm joined today by two amazing and brilliant colleagues. We have our repeat guest, internist, Dr. Vaidy, and introducing our most amazing allergist, Dr. Borczuk. Remember, we are giving general guidance. If you have a particular question about your health, we'd like to help you. So come in for an appointment so we can answer your question and give your health the attention it deserves. So let's get started.
As an internist, we treat allergies quite often. They're quite common symptoms. Usually if the symptoms are relatively mild, some general upper respiratory symptoms, even rashes, things like that, I'll go ahead and try some common treatments, mostly over the counter. And if for whatever reason people are not improving, certainly if they have more concerning symptoms or the symptoms might have already been going on for a while, and anytime I think there's a benefit in seeing an allergist, getting a more expert opinion, and perhaps they can do things that I'm not as familiar with, I'll definitely go ahead and refer.
So first of all, I want to start by telling you that we see whole families. We see from newborns all the way to the geriatric population, which is a little bit different for Concorde because most of Concorde patients are adults. So we typically, our typical day is the nasal itch and drip because we can test them and get them to a better healthy form. But we also help with some more stubborn issues like asthma and medication-related allergies, food allergies, and rashes. Those are something we've been seeing a lot of lately. Okay, so just to start off, we want to make sure we understand that just because your parents had an allergy to penicillin doesn't mean you do. They transmit that gene to have allergies in general, but not specifically to anything, any foods or medications. In terms of why we would test, oftentimes we get the patient who in the past has had a rash, and we really don't know what that rash was due to. So we want to check that out, make sure that they are tested. Penicillin's a great drug. It's a cheap drug. It works for a lot of different infections. And we want to give the best medication to the patient. So we're able to do this rather quickly and efficiently. And it really involves just some scratch testing, a couple of needles. And then if those go well, we would challenge them in the office, supervised, so they can be sure that they're not allergic anymore and they can have this in their lives again.
Borczuk, I was wondering how dependable is this testing? How can patients be confident if they test negative that they can get the antibody?
Absolutely. They wind up being at the same risk as the general population. That's what we say. We go back to where we didn't have an allergy before.
And as an internist, it's very useful. It's a very common thing to have a patient say they have a penicillin allergy. And there are limitations of if I can't prescribe a penicillin. Strep throat, for example, the best drug is amoxicillin.
Sure.
Bacterial sinus infections, Augmentin, which is really amoxicillin as well. And there are alternatives, but they're shown not to be as effective, and they may actually have some adverse effects that penicillin won't have. So there's definitely an advantage to be able to check that with you guys, and I think that's very helpful.
I want to bring up one more point that I didn't mention before, which is it's great for yourself. Right. In the ways we spoke about, but also for our general population. We don't want to have be on bigger and bigger bigger gun antibiotics and cause more and more drug resistance. We want to be more simple.
We already have penicillin resistance, right, and many other drug resistances, so we need to have those big guns reserved, not be resistant to. And we really need that
for a bigger infection. Absolutely.
So that's really important that you really know if you truly have a penicillin allergy.
I mean, adverse effects are very common. They're much broader than an allergy. It really could be any symptom you experience shortly after or in the maybe the few days after taking the medication. More common side effects are stomach symptoms. It could be nausea, vomiting, could be something non-specific, fatigue, feeling more tired. Headaches are a very common side effect. And so these are not allergic reactions. Allergic reactions is when your immune system reacts to the drug. So it'll typically be an itchy rash or something more severe than that. And so those are, I would say, for an allergic reaction, they're probably more significant, and you don't want to take that drug if you have an allergic reaction, whereas an adverse effect may go away, it may be tolerable, and you could still take the drug even if you have side effects, but not an allergic reaction.
Right. So, and I also want to chime in that a lot of people get upset with us if you don't test for the side effect, but we can't. Whereas if it's an allergic reaction, more than likely we'll find a test. We'll devise a test that we can look at, that's reasonable. So don't get upset with us if the side effect doesn't get looked into in more detail.
Right. And that's, it's a very common thing we're dealing with now, and we always have. Unfortunately, it can be a little tricky sometimes. I think the milder the symptoms are, the less differentiating factors you can kind of depend on to figure it out. I mean, with allergies, with colds, COVID-19, if you have mild symptoms, they all can give you a runny nose. You may feel a little lousy, tired with all of those. I think infections typically will give you a fever. That it's pretty rare. I think never happens with an allergy. Body aches, you definitely can get with flu, COVID-19, maybe a really bad cold, but not with allergies. And again, there's a lot of overlap between COVID-19, flu, and colds. Typically, the symptoms are more severe. Of course, we all know that flu, COVID-19 give you pneumonia and more. So the fever might be higher, the symptoms might last longer, it might cause more severe symptoms. So some of it are based on the patient's history, exam findings, and we really depend on testing COVID-19. That's why testing is so important. And as far as allergies, of course, I can talk more about allergies symptoms.
Yeah, I think generally speaking, fevers, chills, muscle aches, it's probably not an allergy. But I want to bring up the fact, especially this season, a lot of the people who wind up having some kind of viral infection, it does cascade into their allergies kicking off. So especially with the heat starting up in the houses, kids going back to school, you pick up more, viruses when you're in school and when you're in touch with people. And we've actually done that this year, which is wonderful. But we do have more allergies kicking up too after a virus.
Some of the symptoms and things we talked about, flu and other viruses like RSV are seasonal. COVID-19, we've seen, unfortunately, the last 2 winters, upticks and spikes because of people traveling, holidays, people being closer together. So I just think general controls that we've learned to do, practice safe practices, washing our hands. We didn't used to be as diligent, but checking yourself for symptoms that are concerning, fever, cough, staying home if you're sick, getting tested. Because like I just kind of discussed, it is difficult to differentiate a regular cold from something more serious like COVID-19. So
from an allergic perspective, this is the season, as I said, the heating season. We're starting to heat homes, and dust mites start going crazy. Even though they're around the whole year, we're more indoors now, and dust mites start going crazy. So we want to limit our exposure to dust mites as well. We talk about coverings, they call them casements for bedding and pillows, hot water washing. I ask people to ventilate their homes. It sounds crazy when it's 32 degrees out to open your windows, or even colder, but it's a good idea to ventilate your home and let some fresh air in and keep the dust mite population down. So these are hot water washing. These are some of the things we do to try to limit our dust mite exposure and not have this constant tug of war between viruses and allergies. many years ago, when I was in training, we used to say we needed, we certainly can develop it at any point in life. Okay, let's start there. But we used to say we needed 4 to 5 seasons of living in an area before we started having or manifesting our seasonal allergies. I think it happens much earlier. I think things run amok within a year of people changing locations. We also used to say, despite the adult side, we used to say little kids really couldn't show their allergies very early on. They do. So I've seen them from baby life, babydom, all through through adulthood. You can have it at any point. Absolutely. So everyone's scared of a needle. I think a lot of people are scared of a needle, but hang on. So I brought a little device today, and it's plastic. And what we do is basically put on little droplets on here. They're little like raindrops, and they're a little pokey, but if you've been stung by a mosquito, this is nothing worse than that. You want to touch that?
Sure.
Not bad, right? Not bad. So we clean off the forearms. We put it on the forearms, and each one represents a different allergen, and we create a little bit of an allergic reaction on your skin. And then in about 15 to 20 minutes, we'll have a response, and we'll kind of put it together with your history and try to give you what you're allergic to and how to take care of it.
A lot of patients come to me and ask to be tested for allergies. They're worried about food allergies, things they've reacted to potentially. And I've read that sometimes certain allergy testing in the blood may not be as reliable, or may not be like the only thing that you test for. Do you mind talking a little bit about that and how you use allergy testing?
Sure. So in terms of foods, we actually put together, it's a composite, it's a picture, it's a huge picture of blood testing plus our scratch testing, plus the biggest part is history. Okay, a history of the patient. You oftentimes get these patients who have these crazy allergy tests that are positive and they don't mean anything in a box, you know? So you have to really relate it to the patient. The blood tests we don't do the blood tests so very often for allergies, seasonal allergies, because these are just more effective and they're cheap and they're available right away. In 15 to 20 minutes, you'll have results, you know, and you know, it's covered by insurance. So these are just more effective.
So this is also, I think, a pretty common thing. And it depends how severe the symptom is and how, for something relatively mild, I think one of the most common symptoms might be an itchy rash. So I think as long as there's no symptoms of other organ systems being involved, respiratory distress, shortness of breath, wheezing, trouble swallowing, swelling. So your kind of standard itchy rash, antihistamines like Benadryl work quite well and are safe and are over the counter. And that would be the first step. Certainly, if you're pretty confident that you know what you responded to, not to put it on your skin or ingest it again. And then if there's any concerns about it getting more severe, especially with your breathing, swelling, trouble swallowing, to call 911 or go to the hospital.
I agree. I think the main thing I'd like to get out there is Benadryl is very commonly used for these minor reactions, but you have to use the correct dose. You have to know what your correct dose is. Also, I think if you have your major organ systems involved, brain, lungs, heart, you know to go to the emergency room by ambulance. But people who might not realize to go to the emergency room is if you have more, let's say 2 systems that are happening. We have that in food allergies a lot, where your skin is reacting, but you're vomiting. So your gut is reacting as well as your skin. If you have 2 or more systems reacting, you better go to the emergency room by ambulance as well. That it is getting more severe. So a lot of people get scared more than anything with hives. I mean, it's very disfiguring. It's scary, right? Yeah, it's very scary. So I feel feel people do go to the emergency room for that. If they have an allergist or internist involved, they might not go as readily to the emergency room. And I don't think they need to go as readily unless they have more, their mouth is swelling, they have throat swelling, et cetera, like we were talking about. I still consider total body hives a non-emergency.
Yeah, and
I want to go back to the total body hives just for a second. If you have total body hives and were stung by you're an adult and you were stung by a venomous sting, sure. If you have total body hives, that's the only time that I would send total body hives to the emergency room, because that could progress. But in a normal situation, total body hives wouldn't be an issue.
And you could call us, and we have our messaging to the portal, and virtual visits are available as well. That's a pretty fairly simple diagnosis to make virtually as well.
But if it's an emergency, call, no portal.
Absolutely. Good plan.
That's what I've learned.
We give EpiPens to people who have food allergies, who have venom sting allergies, like total body reactions. And sometimes when people get the allergy shots, we give them EpiPens as well. The problem with EpiPens is I don't think people use them as much as they should. They wind up relying on Benadryl more than the EpiPen because they're afraid to use it. And if we're putting it in your hands, we are trusting that any time you use it, we're going to support you on that. But I encourage you, not encourage you, I implore you to call an ambulance and go to the emergency room if you use that EpiPen. Okay, so allergy shots are, when you have an allergy, there are two arms of treatment in the beginning. We try to avoid, we give you a lot of measures to avoid, and medications. And there are people who fail that. They don't do well, or they need a little something extra. And so those are people we'll put on allergy shots. There are people who don't want to take medications year round. They want to try to reduce them. And we'll put those people on allergy shots. But I want you to understand that even with allergy shots, it's weekly.
Right.
We want to give it, we are giving it for, you're committed for about a 6-year course. And it's not going to work immediately. So you really need to have your control of stuff in your environment. You need to have medications on board. You need to find what works in order to help you out.
So how soon, so it's like a 6-year commitment, how soon do most patients start getting an improvement in their control of symptoms?
It's a great question. I would say around 6 months to a year if they're committed to it and they come every week. If you're bouncing around, it's not helping, but you need to be committed to it. Right. And about 6 months to a year, we start seeing good changes, positive changes, and we start reevaluating those patients at that time too, to see if they're going in the right direction.
Sure, makes sense.
So asthma, I just want to talk about what asthma lungs look like briefly. Okay, very simply put. So you have twitchy airways when you're little. With asthma, we have twitchy airways for everybody who has asthma, right? So when you're little, you have a tiny airway, and you can imagine if they're twitchy, they shut down very easily. So that's asthma in a child in a nutshell. But as you grow older, you're still going to have that twitchiness if you're asthmatic. But it takes a lot more to close that bigger airway off. Right? Makes sense. Yeah. So what we encourage is people who have, as adults, those twitchy airways from way back when, you want to keep your nose under control. What does that mean? That means you want to keep your allergies under control. You want to keep things that like reflux, colds. You want to attack right from the beginning, chronic sinus infections, anything that drips down from your nose into your chest. We want to make sure that we control. And so I'm going to tell you, like I tell all my patients, I liken the nose to the faucet and the lungs to a sink. And you want to shut off the drip in the faucet before it goes down to the sink, or your sink's going to overflow. You're going to have problems. So please take care of your nasal allergies. And if this particular person you want to take care of this area and be very vigilant about it.
So the thing is that asthma never really goes away. But if you've had it as a child, the potential to develop problems later in life is always there. And so
Exactly.
controlling the triggers, whether it's allergies, colds, or exercise-induced asthma, sometimes is the best way to prevent problems later in life.
That's right. So from up, control this, and this should be in better control.
In terms of allergies, we talked about Benadryl. It's a very effective allergic medication, but it does make you drowsy, which makes it pretty helpful to use at night and the evening. But it does. People get pretty drowsy with it. So the non-drowsy over-the-counter medications, are we familiar with Claritin, which is loratadine, yeah, and Zyrtec is also a very popular one, and Allegra, and they're available name brand and generic, and they're equally as effective. Sometimes if one of them might not work as well, another one might work better for you. So those are all antihistamines, and a lot of times we also use nasal steroid sprays like Flonase, and they work differently. These are topical steroids, and often combining the two is a good way to control allergic symptoms, and they're best used as well preventatively. So a lot of people might use them only when the symptoms start, and it's difficult to get a control of the symptoms that way. It's better if you take them daily, say during allergy season, before you develop symptoms, and also after your symptoms improve, continue to use the medications daily preventatively. That's how they work best.
So I would, I try to stay away from Benadryl because you have to take a lot of it before it's very helpful for, and even all the antihistamines, it's before it's very helpful for allergies. I prefer to do nasal steroids. I like them. I try to start them at the beginning of prior to the beginning of the season, because it could take up to 3 weeks for it to get to its, rah stage when it's doing really well.
Right.
And so I like using them. I also like the fact that you can apply the nasal spray right into the nose where the stuff is going on.
Where the reactions start.
Absolutely. And it's more preventative. Whereas if you take a medication by mouth, it has to go through all your bloodstream before it actually works.
Sure.
But the one thing I'm going to tell you is that the nasal sprays, they are generally about a month's supply in there. And what I find is people telling me they don't work for them. And I think most of the time it's because they are just not using it properly. You have to dispose of it after a month. And I have people date the bottle as soon as they crack it open, throw it out in a month so that they can have, access to a new bottle at that point. And it works.
That. Yeah, that's interesting.
You want to take
Yeah,
that?
it's a name brand for basically a category of sinus rinses and nasal rinses. And the idea is that instead of using medication, you physically can flush out things that might trigger your allergies, dust, pollen, and even preventatively for infections, and clear things like mucus that needs to be drained. And it can be a way of preventing allergies, sometimes even colds. Right.
So it basically dislodges. Your nose has the little hairs in it that it's a filter. It's your natural filter. So we want to clean out our natural filter. We shower. One of the things I tell people to do during their allergy seasons is shower. Change your clothes and shower, but you never shower the inside of your nose. And so the Neti Pots, and there's something called Neilmed rinse, which is basically a plastic bottle, comes with pure salt, and you put distilled water in it, and shake it up, and clean out, shower the inside of your nose and clean it out before using the nasal sprays. They work very effectively to reduce congestion. They work to remove all the junk in there.
Sure. Good question.
So, I'm going to say allergist, right? Like, why would I say anything else? I think the majority of dermatologists would agree with me that we're the ones who are going to see them. They see them, they treat them with antihistamines, and they send them out the door because there's really not much else they can do about it. So I think we're the ones who get the hives.
And that's what I'll typically do. You typically need higher doses, And a lot of it is reassurance. People get really distressed about hives, and
Absolutely.
it's usually not dangerous. And unfortunately, a lot of times you don't find out what the cause is, but they respond well to antihistamines. And so if I do treat people, I'll always refer to an allergist for follow-up.
Yeah, it's very upsetting to people generally that we can't find the
Right.
cause of
Yeah.
the hives, but
Yeah.
we can treat them. And I always tell them, we're going to start by making you comfortable,
Yeah.
because that's
Exactly.
the main goal.
Well, I think I discussed this at the last conversations. I would reemphasize just making sure, especially with the pandemic and us being at home and getting a bit unhealthier, to try to get back to regular cardiac exercise for multiple reasons, for mental health, physical health, and especially getting into cold and flu season. Get vaccinated. Get vaccinated. Get vaccinated. Of course, I think everyone knows, most of the case to know about COVID-19, but just reemphasize your flu vaccine as well. Flu is also potentially deadly. Um, Unfortunately, thousands of people die every year from that as well. And it is also a safe and effective vaccine. And so make sure you get vaccinated or talk to your doctor about getting vaccinated.
All right, let's hear your answer, Dr. Borczuk.
So I will tell you, get that penicillin allergy from your past cleaned up. That's the most important thing for me. I think whether you're a child, whether you're an adult, anybody, just bring them on in. We'll get that cleaned up for you.
Well, thank you all for joining us for another inspirational and educational episode of Concorde Conversations. We know many of you have additional questions, and we'd like to help you. So come in for an appointment. We care about your health. Thank you so much for listening today. Have a wonderful day. Bye, everyone.
All right, thank you.
Bye-bye. Thank you.